Hello, I'm Karen from the 0 to 19 Public Health Nursing Service in Telford and Wrekin. Welcome to this Bumps to Breastfeeding talk. I hope that you enjoy it. If breastfeeding did not already exist, someone who invented it today would deserve a dual Nobel Prize in Medicine and Economics, for whilst breast is best for lifelong health, it is also excellent economics. Breastfeeding is a child's first inoculation against death, disease and poverty, but also their most enduring investment in physical, cognitive and social capacity. So what will we be covering in today's talk? So we'll be covering the benefits of breastfeeding and why to breastfeed, building a happy baby, how milk is made, and how to breastfeed. So we'll be showing you the basics in terms of positioning and attachment, overcoming problems associated with breastfeeding, expressing and storage of breast milk. We'll also talk about breast pumps, returning to work, and we'll also give you some top tips. So why breastfeed and what are the benefits of breastfeeding? Well, I think we all know there's many benefits to breastfeeding, both for mom and for baby, both from a health point of view and also from many other benefits also. So for baby, protection against ear infections, it helps to avoid chest infections and wheezing. Babies that are breastfed have a lower risk of becoming diabetics as well. There's less allergic disease such as eczema and asthma. There's lots of protection against diarrhea, gastroenteritis, stomach upsets. Breastfeeding your baby actually helps your baby to become more clever, so there's better mental development. There's a better mouth formation also, and your baby's teeth as they grow up, they actually are straighter than babies that are bottle fed, because they don't constantly have a bottle in their mouth pulling those teeth forward. Less obesity for children that are breastfed because we're not overexpanding the tummy by giving lots of thick formula. And also breast milk and breastfeeding is an instant soother. When you breastfeed your baby, it's not always about the feeding, it's also about nurturing as well. So for mom, the benefits of breastfeeding include moms get lesser risk of ovarian and breast cancer and also other hormonal cancers. And also it helps to strengthen mom's bones and helps to avoid getting osteoporosis in later life. So other benefits of breastfeeding, it's free, it doesn't cost anything, it's available anytime, any place, so it's constantly there. It helps moms, by breastfeeding helps moms to lose weight quicker. You burn a lot of calories when you breastfeed, but also if you breastfeed, once you've delivered your baby, the uterus actually contracts, so that goes back to pre-pregnancy state a lot quicker than a mom who doesn't give any breast milk to baby. There's less of a carbon footprint, so it's very environmental friendly, so we're not having to cart cartons of formula here, there and everywhere. It's there with you all the time. Nappies are less offensive. The smell of a breastfed baby's poo is a lot more fragrant than a formula fed baby. It's said to smell a little bit like digestive biscuits. Breast milk is constantly the right temperature from the breast, so obviously you don't need to be warming it or cooling it. And you have the right to breastfeed your baby anywhere. You're actually covered by the law. There's been lots of myths in the past about looking after babies, and obviously everybody's parenting techniques are different. This leaflet called Building a Happy Baby, which was put together by UNICEF, dispels a lot of the myths when it comes to bringing up baby and that you can spoil a baby by giving it too many cuddles. So the myth For example, here, babies become spoilt and demanding if they are given too much attention, when in fact, when babies' needs for love and comfort are met, they will be calmer and grow to be more confident. This leaflet is available from the UNICEF BFI website, which I will give you details for at the end of this talk. This is a short animated film on how your milk is made. It's very informative, so I hope you enjoy watching this. So feeding cues. How do we know that baby is ready for feeding? Your baby will give you lots of indications that they're ready to start feeding. For example, if your baby's been asleep and they're just starting to wake up from their sleep, their eyes will be flickering underneath their eyelids, so you'll be seeing rapid eye movements, so that's suggesting your baby is about to start waking up. So your baby will wake up and give some stretches possibly. Then that's time for you to start thinking, oh, baby's probably ready to start feeding. You'll probably notice baby start smacking their lips, might start sticking their tongue out a little bit, wriggling from their head from one side to the other, and they'll obviously still be stretching as well. So these are all good signs that your baby's ready to start feeding. Baby might then start putting the fist in their mouths and chewing on the fist as well. You might have picked your baby up at this point and the baby starts rooting, might start rooting on your neck, on your arm, on anything really, turning their heads to the side. And then finally, your baby will be crying. Really crying is a very last stage of a baby wanting to be fed. Ideally, what we want to do is to get to baby at the earliest stages of the feeding cues. So recognition that the baby's about to start waking up, they're smacking their lips. That's really ideally the best sort of time to be feeding baby. If we leave it too late, such as leaving it till when baby is crying, then that's really a very last resort, and baby's getting stressed, mom's getting stressed, partner's getting stressed, and it's just a situation you don't really want to find yourself in. We want everybody to be as calm as possible when we're feeding baby. So picking up on those first feeding cues is ideal. How to breastfeed and positioning and attachment. So here we have a few examples of popular positions that are used in terms of feeding baby. So on the left we have a cross cradle hold. In the middle top we have baby using the underarm hold. Bottom middle we have a lying down position. And over on the right hand side there, we have what we call a biological nurturing approach. All these positions can be used, or you may just choose to use one position. It's always best to get some advice and some assistance with latching baby on, whichever position you want to try to use. So get some help from your midwife, your health visitor, or breastfeeding support. So how to breastfeed and positioning and attachment. Here we have a couple of short videos from the Baby Friendly Initiative, UNICEF, that will give you some good ideas on and techniques on how to position and attach baby, and also a video on ineffective attachment, so that you know the difference between the two.
Although she began breastfeeding baby Rufus as soon as she could, Teresa needs reassurance. She has asked Nikki, a breastfeeding peer supporter, to come and make sure Rufus is feeding properly.
Little Rufus. I can observe a little feed maybe later. Do you think he's would he be ready to feed now? Or?
He might be.
Nikki explains that if Teresa's baby attaches correctly at the breast and feeds well, it will help her establish a good milk supply for the future and overcome their difficult start.
Just for attaching him, you could try attaching him in cross cradle. Do you know what I mean by that?
Is that where, I think I see it, where you put your arm across like that?
Yeah, that's right. And aiming nose to nipple.
Nikki shows Teresa how to achieve good attachment. Bring the baby's nose directly opposite the nipple. Let his head tip back a little so his top lip can brush against your nipple. This should make him open his mouth. When his mouth is wide open, bring him quickly to the breast with his head back and chin leading. The baby can then take a large mouthful of breast, not just the nipple. The breast will be drawn deep into his mouth, so your nipple will go all the way back to the soft part of his mouth and you won't get sore. So, once your baby's head has tipped back, your nipple will brush his top lip. Wait for the wide gape, then bring your baby quickly to the breast, chin leading. In this position, feeding will be comfortable and your baby will be able to take all the milk he needs.
So long as you've got your position and attachment right, it should be like that. It should be nice and relaxed and enjoyable.
If your baby doesn't attach properly, she may not take enough breast into her mouth, and your nipple will rub against the front part of her mouth where it is hard. This will become painful for you, and your baby may not get enough milk. You can avoid this happening by making sure your baby attaches well and takes a good mouthful of breast, so your nipple is drawn right back to the soft part of her mouth.
So how to breastfeed in positioning and attachment continued. We use an acronym with breastfeeding and how to attach a baby to the breast. Again, as I say, it's always best to start your journey by getting some support from a midwife, a health visitor, breastfeeding support, or a peer supporter in terms of latching baby on. So the acronym that we use is CHIN. So when we're feeding baby, we keep baby close to mom, and we kind of say that we're wearing our baby, so the baby's body is wrapped around our body. We keep the head free, so we don't touch the back of baby's head. If we tend to do that, babies will start pulling back and pushing our hands away. Plus also, if the baby does need to release from the breast, it's not quite as easy as if you're supporting baby kind of around the shoulder and the neck area. So then so we're keeping baby in line, so we don't want any twisting or turning at the neck or at the hips either. So your baby is all in a straight line, shoulders, head, hips and feet also. And finally, we use the final acronym, which is N, for nose to nipple. So when you're latching the baby to the breast, as you may have seen from the previous video you've just watched, we're latching on the baby nose to nipple. We're not putting the nipple directly into the mouth, because then the nipple will just sit on the hard palate in the baby's mouth and will make you sore. So by doing nose to nipple, that will encourage the nipple to go right to the back of the baby's mouth where the palate's nice and soft. So if you were to run your tongue along the roof of your mouth, you'll feel that the palate is quite hard until you get quite a long way back, probably about 2/3 of the way back in your mouth, where it's nice and soft, and that is where your baby's where your baby takes the nipple. So we line the baby's nose opposite the nipple. We wait for the baby to tilt their head back, so the baby's then leading with the chin. So the chin tends to touch the breast first. Wait for the baby's wide gape and then bring the baby swiftly to the breast. And that's quite an important thing to remember as well. We need to encourage the baby to go to the breast quite quickly and make sure that you bring the baby to you rather than you go to the baby. So you need to stay in a nice, comfortable position. So yeah, bring the baby nice and swiftly to the breast. As I said before, the bottom lip makes contact first, and then when the baby is latched, you'll see that the nose is free from the breast and the chin is in. And as I say, just make sure that you're prepared for being in that position for quite a while. So you might want to make sure you've got things like your phone, your drink, maybe a snack, the remote control, making use of cushions off the settee also, just to make sure you're nice and comfy. Here we can see two clips of babies trying to latch to the mom's breast. They're both in a nice position, so they're both aiming for the nose opposite nipple. Baby's mouth, especially the one on the right, is nice and wide, nice and open, nice and wide. So if mom was to bring the baby swiftly to the breast on this side, she would gain a good latch to the breast. And here again we can see two babies offered the breast, both of them coming on nose to nipple. Both of them look like they're going to get a good latch there. The one on the right looks like it's nearly taken the breast into the mouth, because you can see the bottom lip is actually now touching the breast. So with mom bringing baby nice and swiftly to the breast there, that baby would get a nice deep latch. So here we can see on the left side, two babies attached to the breast, both attached well, both look like they've got nice deep latches, chins in, nose is nice and free. So that would be a nice comfortable feed for mom. Mom shouldn't get sore by latching on baby well like this, and also the milk transfer is going to be more effective by latching baby on nicely. Whereas unfortunately the latches on the right here are both very shallow latches. Both the baby at the top and at the bottom are just holding on for dear life to the nipple area by the looks of it. So these babies won't be getting a good feed. They'll get some of the milk, it will kind of be dripping through rather than nice big mouthfuls of breast tissue. And sadly, mom, I would imagine on both of these mums will end up getting sore nipples because of poor latches. Signs of a good latch. So we want to see that the baby's chin is in the breast, and the nose is obviously free if the chin is in. The cheeks are soft and round, so the cheeks aren't being sucked in. We want to see nice round cheeks. Shouldn't be any slurping or clicking or anything like that. There should be rhythmic sucks. So to start off with, the sucks will be quite quick in succession as the baby's pulling the milk through. And then what should happen is you should hear some nice deep sucks as well. And you're looking at a suck to swallow ratio of 1 to 2 sucks and then a swallow. So suck, suck, swallow, suck, suck, swallow kind of ratio. Mom shouldn't be sore, should be no soreness to the nipples. Might be a little bit tender for the first 30 seconds or so. And ultimately the baby is content. And those are really good signs that baby's got a good latch. So a few troubleshooting basics for you. Skin to skin will solve lots of breastfeeding problems. So if in doubt, strip your baby down to the nappy, strip mom down to the waist, have baby on top, and have lots of cuddles and lots of skin to skin. If it is a bit chilly, you can always just pop a little blanket over baby, but they shouldn't be cold because they're next to mom whose body temperature. You could always you might always notice that the baby will start bobbing over and trying to self-attach to the breast, so you can always encourage baby to do that. But yeah, skin to skin does solve a lot of breastfeeding problems. So a few troubleshooting basics then. Sore nipples tend to be a sign of poor positioning and attachment. So as we've just covered, it's important that we do get the latch right, so that we can avoid getting sore nipples. So again, get some support from one of the healthcare professionals, breastfeeding support, midwifery, health visitors. If you're still sore, then we might need to look a bit more into this. Baby may have a tongue tie, so it's always worth getting that checked out, and I'll cover that in just 1 second. Engorgement tends to happen when the milk transfer doesn't happen as well as it should do, and usually that is again down to poor latching, not getting a good latch, so the milk transfer doesn't happen. Breast milk is very much supply and demand. So if your body's taking that milk off, then you will keep making more milk. So if you're not taking that milk off, the body will be thinking, oh, that milk isn't going anywhere. I'm not going to make quite so much now. So whereas you're thinking you've got lots of milk because your breasts are quite full, actually the reverse is happening. Your body is thinking it's not actually needed, so it won't make quite so much milk. So what we're looking for is effective draining of the breast when baby's feeding at the breast. So if we can keep the breasts clear, then that should avoid any engorgement. Self-help measures in terms of engorgement would include using maybe a warm compress like a flannel, or cold, or a combination of both. Savoy cabbage leaves, believe it or not, they're sort of cup shaped, so you can always break one of those off. Maybe leave it in the fridge, break one of those off and pop them inside your bra. That helps to relieve engorgement as well. But again, it comes down to a lot of the time positioning and attachment. Engorgement does tend to be at its peak at around day 3 when you've delivered baby, and your milk tends to come in an abundance at that particular time. So that will settle. Lots of feeding at the breasts, lots of really good breastfeeding support around those days as well. And you might need to do a little bit of hand expressing just to help along the way, which we'll come to in a minute. So mastitis is an infection in the breast, which if you would know about it. It will make you, it'll give you fever, you'll feel achy, you'll feel very much flu-like, you might have a temperature as well. The best way to manage mastitis is to keep draining the breast, either by offering the breast to the baby, so the baby is feeding from the breast. So if you have got mastitis, it is important to keep feeding from the breast. If you're too unwell or your baby doesn't want to feed from you, you might need to express and take the milk off that way. If you are able to, take paracetamol and ibuprofen as directed, and also you may need to make have a telephone conversation with your GP, because some mastitises do require antibiotics as well. Make sure you're drinking plenty, keeping your fluids up, and trying to rest when you can. But again, good support with mastitis is really important there. So tongue tie. Some babies are born with a short frenulum or a tongue tie, which is the piece of skin which attaches the tongue to the base of the mouth. Is sometimes quite tight. It restricts the tongue, so it stops the baby's tongue needs to be free in order to swipe the breast to the back of the mouth. That sometimes needs treating, and have a frenulotomy, which is a small cut on that flap of skin, and that tends to loosen the tongue. So again, good support from your health visitor, midwife, or breastfeeding support is needed here. Thrush can occur in both babies' mouths and also in mom's breasts. It can be quite sore. It can feel a bit like hot needles within the breast tissue. Sometimes you can't always see any thrush on the breast area. It tends to occur towards the end of the feed and after a feed as well. It might look quite shiny on the surface of the breast and the nipple area, or there might be some little white areas on the breast as well, and that would also be the case within the baby's mouth. You might notice some small white specks on the baby's tongue, on the roof of the mouth, and also on the cheeks inside the baby's mouth. Again, this would need to be treated, so you would have to contact your GP. And if thrush is diagnosed, it's important that both mom and baby get treated, because otherwise it tends to go backwards and forwards from mom to baby. So that's something that you'd both need to be treated for. Again, getting some good advice and good support from your healthcare professionals is important here. And just talking about medication in thrush and also with mastitis, information about breastfeeding and medication can be found on the Breastfeeding network. There's lots of really useful information on there about what medications safely being able to take when breastfeeding. So that's the Breastfeeding network. So now we're moving on to expressing, and here we have a clip for you to watch on how to hand express.
The UNICEF UK Baby Friendly Initiative recommends that all mothers are shown how to hand express. This is a useful skill which can be used in the following situations: expressing small lots of colostrum to tempt a sleepy baby in the early stages of breastfeeding, when breasts are full, making it hard for babies to attach, to help clear a blocked duct, or if you are separated from your baby, for example, if your baby is on the neonatal unit.
So when you're hand expressing, start off by doing anything that relaxes you. So having a cuddle with your little one, skin to skin, a bit of massage, anything that helps you relax. So sometimes it could be kneading around the breast, sometimes it's stroking, whatever feels right, whatever feels comfortable to you.
If expressing for a premature baby, massage is important to ensure a good milk letdown. However, if just expressing to soften your breast, just a small amount of massage may suffice.
Once you've done that for some time, if you make a C shape with your hand, with your thumb and finger, gently feel back from the nipple, about 2 to 3 centimetres. Hold it for a couple of seconds and then release. And then just compress, hold and release. Now in the early days with colostrum, this won't come straight away, it can take some time. So just keep working in that one area. It will appear as little beads. As the milk comes in, you'll see it will flow much more easily. Sometimes you might need to move forward a little bit, sometimes you might need to move back a little bit. The main thing is working that one area until it fully subsides. And then what you can do is rotate round the breast and work on the next area, compressing, holding and releasing. So the key thing as you're doing there, you've kept your fingers right in the right place, that's perfect. And the key thing is you're doing that compression right where your thumb and finger are, and you're making sure you're not sliding, and that's really important. When you slide along the skin, it's not as effective and it can also cause a bit of trauma to your skin, so working in that one area, keeping that thumb and finger opposite each other is just perfect.
Ask your midwife or health visitor to talk you through how to hand express. If you are expressing for a baby who is in the neonatal unit, try to express close to your baby or have a photo or a piece of baby's clothing to hand, as this will help boost your milk-making hormones.
So how to hand express. What we need to do before we start doing any kind of expressing, whether that be via using our hand or using a breast pump, we need to kind of prime our hormones. Breast milk is made by hormones, as you may recall from the clip that you saw earlier, which is prolactin and oxytocin. And when we've got baby next to us, those hormones are there in an abundance. When we hand express or when we use a breast pump, those hormones aren't there to the same degree. So we kind of need to get ourselves in the right kind of frame of mind. There's no point thinking, oh, I've got 5 minutes, I'm going to sit down, I'm going to express, I'm going to think about what I'm going to have for tea and worrying about this and thinking about that. What we need to do is try to relax as much as we can. And I know that's not always possible when you've got a newborn baby. But yeah, try and relax. Do a bit of breast massage here, just kind of gently touching the breast area like you saw in the clip earlier. listen to some favourite relaxing music, lots of eye contact with your baby. If you're able to, do some skin to skin or have lots of cuddles with your baby, or maybe you've just had a bit of a feed as well. As I say, lots of gentle breast massages is good here, using strokes or using your fingers all over the breast area. So the technique that we use is you use the thumb and the forefinger in a C shape, and then what you do is you locate the right place for expressing. So you've got the nipple and the areola, and if you kind of walk your fingers back a few centimetres from the base of the nipple, you'll notice that the area feels a little bit lumpy, a little bit like frozen peas in that area. So those are the ducts which are containing the milk there. So once you're in that kind of area, it's just a gentle squeeze and release and squeeze and release. There's no rolling involved, there's no tweaking on the end of the nipple, because the milk isn't actually sat there. It is in that area, as we just talked about, a little bit further back away from the areola area. So it might take a few attempts to do this, but you keep trying, squeeze and release, and then you will notice like a little pearl on the end of your nipple area there. So continue doing that, and again, after doing that for a while, your milk should start flowing, and you should be able to express your milk off by using that technique. Obviously you'll need something sterile to catch the milk in as well, so that could be anything as long as it's a sterile container. So you continue that process for as long as you need to. You might only need to do it for a few minutes if you're just softening the breast area, or if you need to do it to empty the breast, then you might need to walk your fingers around a little bit further clock facing, so that you're draining the ducts from all the way around the breast area. So you continue that, and then you continue it on, repeat it on the other breast also. So storage of expressed breast milk. So you've expressed your milk off, and you've got it in a bottle there. You can store it in the bottle, or you can store it in a breast milk sterile bag. There's lots of different containers actually you can express your milk into and store it in, as long as it's sterile and you've followed the manufacturer's guidelines in terms of sterilising the items. So fresh breast milk can be left out on the side for up to 6 hours, as long as it's at room temperature, obviously not in direct sunlight. It can be kept in the fridge for up to 5 days, and we put it at the back of the fridge and low down, and you can actually store breast milk in the freezer for 6 months. What I would suggest if you are going to freeze it is to write down the amount that's in it, because when it's in the freezer it does actually expand and it makes it look like you've got more than you actually have. So always write down the date and the amount that you've actually got in there. Also, I would suggest to freeze your milk in lots of little clumps rather than one big clump, because once that milk's defrosted, it does need to be used, and it'd be a shame that you've defrosted the milk and then you don't actually need it, and it doesn't get used and discarded. So it's an idea to try to do lots of little bags, and just take out what you think you might need, because it's easier to get some more out if you need some more. Also, what you might notice is your milk does separate, so you tend to get a ring of cream around the top of the bottle or your bag, in which case just gently swoosh it so it's mixed in with the rest of the milk. You don't want to shake it vigorously, just a gentle swoosh so that it is actually mixed in. In terms of heating up milk, if it's at room temperature, then baby will probably just take it at room temperature, or if it's chilled in the fridge, or if it's been in the freezer, you can just sit it in a bowl of warm water, not boiling water, just to bring it back up to room temperature. As I say, don't use boiling water, And also don't put your breast milk in the microwave because that does cause hot spots within the milk. And here we have Breastfeeding Network Express and leaflet, which gives you more information on this. So here we have a selection of different types of breast pumps. There's the Medela Swing, which is top left, which is an electric breast pump. Other makes are obviously available also. There's all sorts of different ones on the market these days. This pump is a nice pump. It is an electric pump and it will mimic how a baby breastfeeds in terms of the short, sharp sucks initially turning into longer, slower sucks. So that's a really nice pump, but as I say, there's lots of different variants as to makes and models out there. Bottom left, this is a hand pump, which is fine if you're going to be using just on a short-term basis. If you're going to be doing it on a long-term basis, you'd probably want something more like the swing pump, which is just above it there. So the pump in the middle, which is called a hacker pump, these are really quite popular at the moment. These can be used to express milk, but they're also very good at collecting drops of breast milk. So say, for example, you're feeding from the left side and you're leaking on the right side. They're very good for collecting breast milk that does that. And at the top there, you can see one of the big breast pumps that we have, which is a hospital grade breast pump. So if you do go home and you're finding that you've got clinical reasons to use a breast pump, we may be able to offer you the loan of a hospital grade breast pump there. What I will say about breast pumps, if you're in the antenatal period, is don't feel you have to go out and rush out to buy a breast pump, because they can be quite expensive. And if you're not sure if you're going to use it or not, then it's quite a big expense. I find that, you can order a breast pump the one day and it comes the next day. So if you don't need it, then at the minute, then just sort of hang fire if you're able to. So returning to work, when you do return to work or just before you go back to work, most places will offer you a return to work interview, or sometimes you have kind of drop-in back to work days or a few hours each day. If you are breastfeeding or you're choosing to express when you return to work, then it's important you have this conversation with your manager, so that they can make the necessary arrangements for you to store your breast milk. And you do have the right to express your breast milk when you're at work, and have somewhere clean and tidy to store your breast milk, i.e. in a clean fridge within your workplace. But as I say, these conversations are really important to be had with your employer. Any issues that you might have in terms of returning to work and breastfeeding, you can always look at maternity action. That covers your rights for returning to work and breastfeeding. And finally, for this talk, here is a list of just some top tips that you might want to have a read through. All important information listed there. I think one of the most important things I can share with you is to get some support, and don't sit there feeling that you're on your own. This tends to happen sort of about 3 o'clock in the morning when you think you're the only person that's awake and you're trying to figure out how to breastfeed. And I always say to mums, when you're learning to breastfeed, your first 4 to 6 weeks, they're like your practice period, if you like. This is where you're learning to breastfeed, your baby's learning to breastfeed. It's all new to everybody. So give yourself that time, give yourself that patience. You will feel like a bit of a cow in a milking parlour initially, I know. but that does ease, and it does become easier. The first 4 to 6 weeks, it is the hardest time, but once you've got over that, then you will start to reap the benefits. So as I say, keep going, get some support from the healthcare professionals, from your friends, from family as well. Don't feel that you're on your own. We're all here to support you.